Hello, and thank you for joining me today. My name is Ashley, and I'm with Homeward Trust. Today we're going to be talking about Edmonton's bridge housing model and how we adapted it as a sector emergency response to the COVID-19 pandemic. But first, I'd like to take a moment for a land acknowledgement. Homeward Trust respectfully acknowledges our place here on Treaty 6 territory, the traditional and ancestral lands of many First Nations, Métis, and Inuit people. We acknowledge the diverse Indigenous peoples of this land, which include the Cree, Blackfoot, Dene, Iroquois, Anishinaabe, Nakota Sioux, Inuit, Métis, and many others whose footsteps have marked this land for time immemorial. Those whose stories, languages, and culture continue to thrive today. We acknowledge ourselves as visitors living and working in this territory. Now for a little bit about Edmonton. Edmonton is the most northerly city in North America with a metropolitan population of nearly 1.5 million people. And a fun fact, the North Saskatchewan River Valley in Edmonton is North America's largest continuous urban green space. There are over 150 kilometers of trails for year-round activities and 22 parks in the space. Not what normally comes to mind when thinking about Edmonton. Unfortunately, we have over 22,000 Edmontonian households that live in extreme core housing need, and Edmonton's by name list currently is roughly 2,700. Over 5,000 individuals experiencing homelessness were on the by name list at some point in 2021, and that includes over 4,500 adults and almost 700 dependents. So about Homeward Trust. Homeward Trust acts as the system planner organization and has board representation, including mandated Indigenous representation. Our day-to-day system operations and strategy work for advancing the plan to end homelessness as one of the 61 designated federal Reaching Home community entities across the country. Homeward Trust is a community-based organization for the Government of Alberta's investment in ending homelessness, and we manage funds on behalf of all orders of government to ensure maximum impact. We engage with diverse stakeholders through collaborative planning, research, advocacy, and capacity building. Homeward Trust also delivers key services centrally in the homeless serving system, including coordinated access and assessment, the homeless management information system, housing first rental assistance, and the social enterprise find furniture bank. Best practices in ending homelessness have increasingly recognized the importance of system planning as integral to the community response. Such approaches consider the homeless serving system as an integrated whole comprised of defined components working towards common goals. The diagram here presents the key components of Edmonton's homeless serving system. It is important to note that each of these components plays a particular role in the homeless serving system. It is the relationship between these interventions articulated at a system level that ultimately drives common community goals. Homeward Trust works to advance housing first and other innovative evidence-based supports and housing approaches that are tailored to local context. We also support best practice learnings for agencies, policymakers, and peers by sharing learnings, providing technical assistance and training. Homeward Trust is a champion for homelessness issues locally, provincially, and nationally. So what is bridge housing? Bridge housing is an emerging model that is not as well defined as intensive case management or rapid rehousing. We originally designed this for the purpose of a short-term stay that's a continuous accommodation, so there's no need to leave during the day like a shelter system. There's supports offered on site. It's low barrier, and its primary audience for us was people sleeping outdoors. However, this model was adapted quickly as part of the COVID-19 response, which is what we're here to talk about today. Bridge housing is a short-term continuous stay accommodation that's helping people bridge the gap from homelessness to permanent housing. On-site and in-reach supports are offered to assist individuals with meeting basic needs, while individuals work with community supports to to secure permanent housing as rapidly as possible. Residents are intended to stay for an average of 30 to 90 days before moving on to housing that works for them. Over the course of April 2020 to May 2021, System Partners and Homeward Trust worked together to open 5 bridge housing locations throughout the city of Edmonton. This allowed for us to have over 400 spaces of temporary accommodation during the height of the pandemic for community members, not only to have an opportunity to feel safe and secure while working towards housing, but also to be able to isolate without fear when feeling unwell. During the pandemic, bridge housing took advantage of the drop in tourist stay hotels and reserved accommodations to make available for either bridge housing or for isolation spaces for people experiencing homelessness. By coordinating with the sector, System Partners were able to modify the availability of bridge housing or isolation spaces depending on usage and demand. In bridge housing, we offer Tier 2 isolation, and Tier 2 isolation is isolation for individuals who are close contacts with positive COVID-19 cases that are not showing symptoms but are still required to isolate for 14 days. Why bridge housing is so important for us during the pandemic. The model of bridge housing has evolved over time, adapting to the sector needs as we live through the ebb and flow of a major historical event. Allowing individuals to access a safe place to stay while working towards permanent housing with highly adaptive modeling that has allowed agencies to pivot as service needs dictate through the pandemic. Examples of this include, we started with one site in April of 2020, and it was quickly apparent that the needs were outpacing the availability. Sites were opened in September, December, and then in May of 2021, with the focus on serving the unsheltered population. We have seen over 1,300 unique individuals over the last year and a half. We utilized multiple sites for Tier 2 isolation with the capability to scale the number of spaces available. And we were also able to assist some of the higher needs demographics that are dictated by such factors as environmental, health needs, pandemic, mental health, and more. We were originally focused on the unsheltered population, but focus shifted to encompass individuals accessing the services at Edmonton Expo Centre during the first wave of the pandemic who did not have a safe place to stay. Community members initially connected in real time to Housing First teams as they entered into bridge housing. But as bridge housing grew, the demand outpaced the capacity of the housing sector and the availability to connect in real time. These are our 5 bridge housing locations in Edmonton. Bridge housing provided a reprieve for participants from the impacts of the complex and rapidly shifting landscape of services. With all the closures, reduced capacity due to distancing, and intense adaptation agencies had to do during the pandemic. Bridge housing offered a safe place where people could go, get some rest, safely isolate, and have the headspace to focus on the bigger picture for what they wanted to see in their lives. It was a starting point for recovery from the experience of homelessness. And with the ever-changing pandemic landscape, bridge housing in itself had to adapt to shifting areas of need as the sector response. And these are a few of the following ways we saw it happen in real time. We added in on-site and in-reach services to all of our bridge housing locations. Some of them include medical support, on-site nursing teams, PDD support, which is persons with developmental disabilities, housing access supports, addiction supports, and mental health supports. And an example of this is Sandy's Place, that is operated by Boyle Street Community Services. This started as a Tier 2 isolation space in the winter of 2020, and with 46 spaces available, they have pivoted over time as Tier 2 needs decreased to provide full bridge housing supports on site. Sandy's now operates as a bridge housing location with individuals who are both connected and unconnected to housing workers. Our next example is Sands Hotel, that is operated by Naganan Housing Ventures. This is an Indigenous-led site that has 53 bridge housing spaces, but has moved to 50 bridge housing spaces to allow for 32 bridge housing overflow spaces that differ from shelter spaces as they are continuous state and low barrier. These are situated in the banquet halls within the hotel. Sands Hotel offers on-site services such as persons with developmental disability supports, Indigenous midwives for their pregnant guests, cultural services, and more. Another example is Travel Lodge West. This is operated by Jasper Place Wellness Center. They started out with 150 bridge housing spaces and 40 Tier 2 isolation spaces, but they have been able to adapt to the current needs by opening or closing an isolation floor, which accounts for 20 rooms, to allow for the expansion of bridge housing. With the support of George Spady's mobile support team, they have been able to offer medical supports, such as wound care, but also facilitating connections to primary care doctors. Overall, housing never stopped in Edmonton during the pandemic. And we have housed on average 145 people per month, which is actually 5% above the pre-pandemic year. We are also supporting approximately 13% more people on caseload than pre-pandemic. There has been significant inflow into the homelessness sector, and there are limited options for more supportive housing. We have 210 new units of supportive housing coming next year. And again, from April 2020 to today, 1,313 people accessed bridge housing. There are currently over 300 people staying in bridge housing, and 435 people have moved into housing. With that, we've also faced some sector-wide challenges. We have time-limited pandemic funding, and we rely on federal and provincial support for these bridge housing sites. Also, we've had outbreaks at sites, which provides challenges to keep guests and staff safe while we can work towards housing. It also does not allow for us to do intakes at the sites that are under outbreak, which can impact the inflow into bridge housing. We've also come into resistance from neighboring communities with the not in my backyard challenges, especially in our more central locations. And again, we have some outflow challenges with supportive housing spaces not currently available until next year. And finding connection due to teams can be slow due to staffing availability and sector-wide attrition through the pandemic, as people are facing their own complex stress through the pandemic. There has been measurable outcomes and success, though. We've had great interagency collaboration. We work from each other's strengths, and we provide wraparound supports. This includes getting guests into supportive housing sites when many other options and systems have failed them over the years. Another great thing is we've been able to stabilize some higher acuity guests where they have been able to successfully be housed in market housing with intensive case management supports. And some guests have solved their own homelessness, where bridge housing gave them the ability to rest and have access to basic needs so that they could focus on their housing. And another great thing, and probably my favorite, is that bridge housing operator collaboration has allowed us to do internal transfers of guests between sites to help mitigate potential negative outcomes and avoid sending folks back to the streets, making sure that we can keep people safe. We also have a harm reduction model, and while overdoses do happen regularly, the staff are able to resolve quickly and limit all negative outcomes. And if you'll give me a moment, I'd love to show you a video of one of our bridge housing sites. And it'll take me just a second to get that up.
Where would people go? Like, if this bridge housing didn't exist, it's there to help people.
Edmonton has had a really, really successful Housing First program, and we have housed about 11,000 people since the beginning of the program. But for a lot of that work, for some of the people that teams work with, having a place to work with them has been one of the significant barriers to actually having a successful housing outcome. So there's many people that we have housed that have gone from an experience of homelessness into their own home. Having bridge housing, it is the opportunity to have some privacy, a stable environment, a supportive environment that remains very housing focused, but gives some time to work with an individual that may otherwise be living rough and really difficult to reconnect with.
Where I was staying, it was like a little camp, and an outreach worker was showing up there all the time, and she was trying to convince my friends to be a part of the program, to get housing before it was snowed. She's very sincere. Really, I thought she really cared. I didn't know about the program at all. It's really nice. It's a good feeling, and the thing is like I never realized that there was even programs like this.
Bridge housing fills the gap between the shelter system, people transitioning out of homelessness and moving into a permanent home. So it's short-term stay, 30 to 90 days typically, where people can get those supports, build a housing plan, and transition into a more permanent home.
Like I was homeless, I had nowhere to go, and the housing people, they're helping me. Like, they're helping me as well as I'm helping myself. Like I've been going out looking for apartments and that, but it kind of gets, it's a struggle, and the struggle is real. The struggle is real because like right now I have no financial assistance whatsoever. How do I get to point A to point B, to go view a place and that? But they've given me rides and stuff like that, which is good, which is awesome. And the work that they do and the things that the help that you get is it's I don't even know how to explain the feeling like when you, like, who does that?
This facility came to our attention when our section was looking for emergency response space, winter shelters. When we looked at this facility, we noted that it would actually be an even better fit for bridge housing, which is something sorely needed in the homeless serving sector. We have a window of opportunity where we can, before the site is ultimately redeveloped, use it for this bridge housing purpose for the next 3 to 5 years. This building was built in the early 1980s and was used for the next 40 years to house jockeys that were riding horses at Northland's racetrack here. It was really nice to work with a facility that was built with a residential use in mind, especially when it has a commercial kitchen, showers, washrooms, all of those things you don't find in some of the other spaces you'd try to repurpose. The renovations required only a light touch, so some new flooring, fresh coat of paint, ensuring that all of the windows were sealed and intact, and opening up the space a little bit to allow for some amenity space. The big cost efficiency is that we found a building that works that would otherwise be torn down, and the replacement cost is in the millions, where for a few $100,000 we're able to polish up this building and have it ready for use in a short period of time. Well, if we factor in maybe a 90-day stay for those people, that could turn into around 150 people housed per year.
There is no one journey into homelessness, and there's no one journey out of homelessness. The opportunity with bridge housing is that there's staff on site that really are connected to the work and understand individuals and understand how diverse the group is.
You got your workers, and they're kind of guiding you in the right direction, and they're helping you as you go along the way.
But really, the ideal setting allows an opportunity to assess those tenants, see what kind of housing option would work for them on a permanent basis, make sure that they have the supports and the plan in place that they would really benefit from to ensure that they can maintain that permanent housing going forward.
So what I got now, I didn't have for a lot of years, and I'm going to really work on keeping that.
And why there's so little of it? I guess because we rely on the shelter system a lot, So many shelter beds, but what we really need are those next steps. That's why the focus has shifted to permanent supportive housing.
It isn't unusual for us to have to explain and reconvince people that ending homelessness is possible. There's definitely challenges with people getting their head around the idea that such a massive social challenge can be overcome with really intentional, planned effort. The fact is, we've done it over and over again, one person at a time. And there's so many really awesome experiences that we've had in connecting with people that have written us that, years after being through the program, have reflected on the opportunity to just have housing changing their entire life.
It feels so much more fulfilling to see a building that would have otherwise been torn down have a second life and put a roof over the head of people who really need it the most.
Tomorrow I move into my new place. It's a small place. It's in a quiet area. I'm really happy with it. I get to make it my own, and I'm really excited about that. I think maybe further my education would be a next step, and I'm going for the positive. Where would people go? Like, if this bridge housing didn't exist, it's there to help people. Where would people go?
And I just want to say thank you again for everyone joining us, and a special thanks to our bridge housing operators, Megan Ann Housing Ventures, Boyle Street Community Services, Jasper Place Wellness Center, and Homeward Trust. Thank you again to everyone who's joined us today, and we look forward to the Q&A after. We'll talk to you soon.